Hello guys, welcome to the new episode. Now guys, in this episode we're going to talk about vital examinations. What are the vital? Vital means something very important, something very crucial which you need to examine on your patient. And what are the instruments or what are the equipment that you need in order to carry out a proper vital taking, guys? In case you're monitoring that patient in the ward, you need to be assessing the vitals. In case maybe you are there, the patient comes you are in the outpatient department, the patient comes present in the hospital, first thing you need to check the vitals. So what are we talking about the vitals? What are the common vitals? So the common vitals you know very well is the blood pressure of the patient. You need to take the temperature readings of the patient. You need to take even the auscultation. Now you need to look at the breathing pattern. What's the breathing pattern? You need to auscultate that patient of yours to know very well, to know how the breathing rhythm, even to assessing the respiration, guys, you will need the stethoscope. So guys, the very crucial equipment that you need in proper vital taking is the blood pressure machine. So this is a blood pressure machine, basically, guys. So we have different types of blood pressure machine. Like basically, maybe this one, I'm going to use it basically in the outpatient department. Now, when it comes to the ward, we are having the monitor, the one with the monitor display. Now you just move it around with a trolley. So basically that's why you use it in the ward department. But for your quick reading of or taking the blood pressure reading, maybe in the outpatient department, we are going to have this. Let me call it portable. Is the portable blood pressure machine, basically. And how do you interpret the readings on your blood pressure machine? So basically you need to know very well. You need to know the normal ranges of the systolic, of the diastolic, or the pulse rates. Always you need to have it on your fingertips so that you can coach quickly when there's an elevation or there a decrease maybe in the blood pressure reading of a patient. So guys, you know very well on how to use this blood pressure machine. It's very easy, very easy to use it. So guys, another thing we're going to take is the temperature reading of the patient. So we can have the mercury thermometer, which currently is in the other unit, and I don't want to go and take it, guys. We're having this infrared thermometer. It's a very easy one to use. So guys, you just get on the patient's forehead, you point the thermogun on the patient. Basically, it's going to display the temperature reading of the patient or the person that you're taking the temperature readings there. And guys, now I'm talking of the stethoscope. So stethoscope, basically it's also included. I know mostly nurses here in Kenya or in our locality, we don't include a stethoscope in our vitals taking. Because I know, guys, we find it like, oh, basically maybe it belongs to the medical officers or the clinician. But guys, you remember to have your stethoscope on the tray containing your vital taking instruments. Guys, remember to have a vital taking sheet. So on the vital taking sheet or chart, you are going to chart your readings of the vital taking from the patient. Basically, it is very crucial while in the wards where there's a patient that maybe you are monitoring or you are managing. So it's basically you are following up. Maybe you are taking the vitals half hourly, quarter hourly, or after 2 hours or after 4 hours. So guys, you need to have that chart that is going to guide you very well on charting each and everything that you're doing. Now guys, the most important thing in vital taking, you need to know the normal ranges of your vital readings, guys. You need to know the temperature. What is the normal temperature of a newborn? What's the normal temperature of a child? What's the normal temperature of a pediatric, basically? What's the normal temperature of an adult? So guys, you need to know the normal readings of the vitals, starting from the neonate to the infant, to the pediatric, to the adult, guys. You need to know the normal ranges of the vitals reading, guys. If you have any problem, maybe interpreting the vital signs, you have any problems interpreting anything, guys, make sure you consult. You understand, because vitals are very crucial. because they indicate the health status of the patient. So proper interpretation of the vitals is very, very crucial when you are assessing your